Hey guys, so for this week we discuss alterations of the cardiovascular system. We were asked to create a video that discusses the results that we observed from the virtual lab that we participated in and what were the factors that contributed to the conditions exhibited by each patient. I participated in that cardiovascular virtual lab. We had 3 different patients who exhibited different symptoms. We had to do things like echocardiogram, MRI, stuff like that to basically evaluate those symptoms and then diagnose each patient properly. And then I have obviously information on each diagnosis. So patient A pretty much came in and presented syncope, I think is how you would say it, or fainting, which is often related to the decreased blood flow to the brain. The heart sound revealed that a systolic murmur, indicating abnormal blood flow during ventricular contraction. And so on the echocardiogram, the aorta was enlarged, and the MRI confirmed the presence of an aortic aneurysm without other abnormalities. And the pedigree analysis showed an autosomal dominant inheritance pattern. And the ECG findings identified that the condition as Marfan syndrome. And so Marfan syndrome is like a connective tissue disorder caused by mutations affecting fibrillin, which weakens the structural integrity of those blood vessels. The contributing factors to this are genetic mutation, autosomal dominant inheritance, weak connective tissue, progressive dilation of the aorta. And so these factors lead to aortic enlargement and risk of aneurysm, which can reduce effective circulation and explain the patient's fainting, basically. For patient B, they were presented with breathlessness and erratic heartbeat, suggesting impaired cardiac efficiency. The heart sounds showed abnormalities in both the S1 and S2, indicating disrupted valve or blood flow function. The echocardiogram revealed an atrial septal defect, ASD, meaning that there's a hole between the right and the left atria. And the pedigree suggested that an autosomal recessive inheritance pattern, and the ECG findings pointed to Ellis-Van Creveld syndrome. And so that's associated with congenital heart defects, especially atrial septal defects. I have never heard of that in my whole entire life, like Ellis-Van Creveld syndrome. What? I'm sorry. Contributing factors: genetic inheritance, autosomal recessive, structural defect in the atrial septum, and then abnormal, my gosh, I cannot talk tonight, blood shunting between the atria. And so the factors result in inefficient oxygenation, and increased increased cardiac workload, explaining the breathlessness and irregular heartbeat. And then as we move on to patient C, who had symptoms of like shortness of breath, fatigue during exertion, which are common signs of reduced cardiac output. A murmur was detected during auscultation. I really just can't. I'm gonna just keep it going because this, the whole virtual lab, I think I literally didn't even do that good on it. It was a lot. I've never, the heart's complex for me. Well, I'm just going. Okay. Anyway, a murmur was detected, indicating turbulent blood flow. The echo showed a thickened mitral valve with restricted movement, and an ECG findings confirmed mitral stenosis. The pedigree findings suggested that this condition is not hereditary, meaning that it was likely acquired rather than genetic. And so contributing factors could be structural narrowing of the mitral valve, reduced blood flow from the left atrium to the left ventricle, and possible causes such as prior infection and valve damage. And so these factors can lead to decreased cardiac efficiency and blood back up into the lungs, causing dyspnea, I think is how you say it, and fatigue. And so for each patient's condition, it was influenced by different factors, obviously, including genetic inheritance, structural abnormalities, and acquired valve dysfunction, all of which impacted normal cardiovascular function and which led to their symptoms. Thank you.